So good morning and thank you for joining the session today. My name is Laura Baker and I'm a research officer here at Swansea University and I work within the population data science team. And today, quite aptly starting off, kicking off this cancer webinar section, I'm going to talk to you about the cancer specific data sets that are generated in Wales and how we can harness them to enable insightful research which could positively impact the patient journey or inform policy. So just to start off then, a little bit of context about cancer as a disease. Cancer is a disease that will cause normal cells in the body to proliferate in an uncontrolled manner, which can ultimately lead to the metastasizing of this disease to other body parts. This is a result of many genetic mutations, which can be caused by a variety of factors, ranging from both external, things like carcinogens, to internal, where conditions like long-term inflammation or even a genetic inheritance can really cause the onset of disease. Given this, cancer is extremely complex and it leads to a significant public health issue, and it is one of the leading causes of death globally. This places, alongside aging populations, places a great demand on healthcare services. In Wales alone, around 20,000 people a year are diagnosed with cancer, with just under 60% surviving over 5 years. With figures like this, there is still a large need to improve effective detection, treatment, and intervention strategies. And this has been quite hot in the press, looking at how Wales is ranking comparatively against not only other nations within the UK, such as England, where we are comparatively worse, but survival outcomes, but also other countries within the EU. So as a result of this, several strategies have been brought out in Wales to really try and tackle some of the issues that we are facing. And one of these is the Cancer Research Strategy for Wales, or the QUEST strategy. This was initiated in 2022 to try and drive a coordinated approach to cancer research by enhancing the existing research excellence strengths and expand the scope of cancer research activity across Wales. So the work I'm going to talk to you today really falls within the 6 themes that were identified as strengths within Wales, and we sit nicely under the prevention, early detection and primary care and health service research. So really, to summarise what we've been working on for the last year, this extract from our IGRP application provides real good scope of what I'm going to discuss further on in these slides. Our project is aimed to build the knowledge on what is feasible with the Welsh Cancer Data and try and serve as an enabler for researchers, healthcare professionals, policymakers and other members of the public who want to explore what novel population cancer research questions could be answered. This is important as there is a wealth of information out there, and I think it's really just in its infancy of being tapped into. So to highlight this, SAIL itself as a trusted research environment houses an abundance of data which is accessible pending approvals. And since its origin in 2007, over 800 publications have been released into the general domain. Of these 800 publications, only 3% are cancer focused, which really highlights the infancy of using cancer data at a population level. And we really want to try and improve and drive more engagement with these cancer data sets to inform policy and the patient journey. We really want to develop this comprehensive understanding, promote and encourage the use of these data sets amongst researchers. And to do this, we're going to publish a series of data explains, which look at categorizing all of these data sets and demystifying the data. Importantly, patient and public involvement has been embedded throughout the whole journey of this project, from the input provided into the initial QUEST strategy all the way through to the IGRP application for the project. And we really look to continue embedding PPI across any further research that results from this initial study. So when talking about population level cancer data sets, I think it's important to go back and look at what a health record is and how that can really inform population scale research, which looks at using electronic health records that consist of data that has been regarding someone's health made on behalf of a professional in a diagnostic care or treatment. Using these electronic health records, it can enable an abundance of population scale benefits, looking at a reduction in aspects of cohort sampling bias, increasing the scale of the cohorts that are recruited onto studies, facilitating linkage to a wider range of data, accessing more granular information across different data sets, providing a longitudinal overview of people's health and well-being. And it's as close to real time as possible. And in addition, it's also cost effective as it reduces burdens such as setting up more cohort traditional studies of recruiting people in practice and clinic and following them up manually. So what are these data sets that live in Wales and how can we use them to drive population level studies? Well, there's general health and care data sets that look at more GP records, critical care, intensive care, emergency department, but there's also cancer specific data sets, which I'm going to talk to you today about in more detail. And really I want to drive that the benefit of using these data sets is that we can facilitate linkage to other primary and secondary care healthcare records, which can enable more niche and specific research questions to be developed and interrogate other additional factors that are going to influence the disease progression and outcomes. So start off, one of the gold standard data sets in Wales is the Wales Cancer Intelligence and Surveillance Unit, or the WCISU data. This is a national cancer registry, which covers just over 500,000 people and contains over 1 million records. This is a minimum cancer data set, so it provides really robust classifications of cancer diagnoses, which have been conducted by a team of cancer experts who look to robustly classify every cancer case in Wales. Within SAIL, there are 3 views. There's the anonymous linkage field view, which contains all demographic information on the patient, the neoplasm, which is more tumor level detailed, and the treatment, which provides a little bit of context into treatments that people have received. And this data set really is a snapshot in time that highlights individuals who have been diagnosed with cancer. So what we wanted to do is we wanted to really do a deep delve into this data set, examine all the fields and look at the potential of what can be done individually with this data source, and then how this can be applied to data linkage to develop more robust studies. And just to provide a little example is that we just looked at how we can track certain cancer types and their diagnoses over time. And more details around what I've discussed here will be published soon in a Data Explained. So next then is the Cancer Network Information System. This is by far one of the largest scale cancer data sources that Wales has. It's a system generated summary of a patient's cancer record, which contains over 800,000 people and approximately 12 million records. There's over 500 fields within this data set, and it's a data repository for all aspects across Wales of cancer diagnosis and treatment. It's the main source of data when evaluating patients' care and diagnosis, and it does inform cancer registration. It is a live system that enables multiple organisations to record and share information about a patient's cancer journey and their follow-up care. However, there are current limitations with this data set. It's only accessible to around 2,000 healthcare professionals and is currently being phased out and replaced with a new data set to come. However, it does cover a breadth of time throughout Wales's cancer recording journey and still houses an abundance of data that can be utilised to look back retrospectively. Just to delve a little bit more into the granularity of this data set, there are 14 views which cover demographics, diagnosis and treatment, and within our Data Explained, we tried to take you on a data journey of how these views can be used and interact together to really address cancer level, population level cancer studies in Wales. Again, I thought I would present just as we did that deep delve into each field and see what potential the data houses, and we can do similar to what we do with the registry data, is we can look longitudinally at the cancer diagnoses in Wales and break that down into cancer specific sites. And this is just one example. We have further that will be published in the Data Explained, which will hopefully be provided soon. Following then, a relatively new data set is a suspected cancer pathway. And this relates to all individuals who are suspected of having a cancer diagnosis, and they are entered and recorded across all cancer services in Wales. This was only implemented in 2019, so the breadth of it is relatively small. The aim of it is to set targets for more rapid cancer diagnosis and treatment provision and identify areas that require support. So it looks at things like date of the first GP visit, date of the first diagnostic test, and so on. It's only one view that has 85 fields, and again, it's a lot of timestamp data looking specifically at the diagnostic journey of individuals in Wales. Similarly, we've looked again and delved into these fields, and you can look longitudinally at the people who enter the pathway versus the people who are receiving primary cancer diagnoses over time. And more of this will be to come in the Data Explained that will be published shortly. There's a radiotherapy data set, which is aiming to gather all the technical and clinical information on patients receiving radiotherapy in Wales, and to improve the availability and the use of this data to inform research. It provides intelligence for service planning, commissioning, and clinical practice. And it contains 3 views: the ALF, which again is more demographic, the fraction, which contains more detailed level and granular level radiotherapy treatment information, and the preparation, which is a mix of the both. As I've discussed previously, we've done a similar deep delve and published how we can use that data as an independent data source within our Data Explained, which is to come shortly. And then finally, just looking at the screening data sets in Wales. There are 3: the breast test Wales, the cervical screening, and the bowel screening. Breast test and cervical screening contain 4 views, which look at the demographic information within the ALF, invitations, dates that are sent out to people, whether or not they accepted that invitation and went on to have screening or testing, and then any subsequent assessments that were identified. The bowel test has slightly less views than the other 2, which are the ALF, invitations, and test, but also cover the same breadth of information. These datasets allow analysis of screening uptake, demographic characteristics of people invited for screening, and any outcomes associated with that screening uptake. And more of this will be coming soon in our Data Explains. So, based on the summary of these data sets, why are we here talking to you about them today? These data sets are really truly in their infancy of being utilised. As I talked about earlier, only 3% of SAIL publications really focus on cancer in Wales. And there's a plethora of information that can go on to really positively impact the patient journey and their outcomes when diagnosed with cancer. So we thought, well, how can we talk to you today about what you can use these data sets for? And I just gathered together some example research questions of how data linkage can facilitate more insightful cancer research, population level research questions. So just a few. Can cancer be predicted through retrospective analysis of GP attendance trends prior to their diagnosis? How do socioeconomic factors of geographical location influence the detection, treatment, and progression of cancer? What role do comorbidities or their treatments play in cancer development and prognosis? Are there geographical clusters of high cancer prevalence? And are they associated with environmental impacts? Does mental health play a role in cancer outcomes or healthcare seeking behaviour? And you can also look at retrospective clinical trial analysis and identify any covariants which may influence the trends. And that's just to name a few. So how can you access this data? It's through a robust application process, which takes approximately 12 weeks. And if you want to talk, some top tips about when you go to develop your project, discuss the feasibility with the SAIL team as soon as possible. engage with the PPI panel to really keep the patients at the heart of this research, identify costs and funding that can support the fees, and for any other additional guidance, the SAIL webpage has a really insightful and useful guide that can talk you through, or contact the rest of the team, Dr. Aaron Lacey or Professor Ashley Akbari, for more information. So just to summarise then, there is a real need to enhance cancer prevention, detection, diagnosis and outcomes in Wales. Population level studies offer insight to identify areas of strength and improve and inform policy. Data linkage can enable the evaluation of specific and niche parameters in cancer care, but there is a wealth of cancer data which is really in its infancy of being utilised and has a significant potential for impact. And that's it then for me. Thank you so much for your time and bearing with me through my abundance of slides. I really appreciate it.